This module on workforce safety and wellness will provide an overview of standard safety precautions to be employed within an EMS agency to reduce overall risk to EMS providers. Once completed with this module, you should be able to identify standard EMS safety precautions. Generally speaking, there are numerous things healthcare workers can do to foster a safe working environment. Because healthcare workers are exposed to sick people on a regular basis, hand washing is an absolute must. The Centers for Disease Control and Prevention states that regular hand washing is one of the best ways to remove germs, avoid getting sick, and prevent the spread of germs to others. Proper hand washing can actually reduce community illnesses such as diarrhea and respiratory illnesses by as much as 16 to 40%. The CDC specifically recommends washing hands before, during, and after preparing food, before eating food, before and after caring for someone who is sick, before and after treating a cut or wound, after using the toilet, after changing diapers or cleaning up a child who has used the toilet, after blowing your nose, coughing, or sneezing, after touching an animal, animal feed, or animal waste, after handling pet food or pet treats, and after touching garbage. The CDC recommends the following steps when washing hands. First, wet the hands with clean, running water, warm or cold, turn off the tap, and apply soap. Second, lather your hands by rubbing them together with soap. Be sure to lather the backs of your hands between your fingers and under your nails. Third, scrub your hands for at least 20 seconds. Most people do not scrub their hands long enough when washing their hands. After that, rinse your hands well under clean running water. Lastly, dry your hands using a clean towel or air dry them. If soap and clean running water are not available, using hand sanitizers with at least a 60% alcohol content can be a good substitution. Keep in mind, however, that sanitizers do not eliminate all types of germs, are not as effective when hands are visibly dirty or greasy, and might not remove harmful chemicals. The next general safety precaution any EMS provider or agency can take is to ensure compliance with Federal Occupational Safety and Health Administration regulations on workplace safety. While Wisconsin is not an OSHA-approved planned state, and OSHA regulations do not apply directly to governmental employers, the state does adopt numerous OSHA regulations into state law for governmental employers, and private, non-governmental ambulance services, hospitals, and other healthcare entities are indeed covered by OSHA. Within these OSHA regulations are numerous provisions governing various workplace hazards, such as walking and working surfaces, maintaining means of egress, occupational noise exposure, hazardous materials, fire protection, emergency action plans, first aid, machinery guarding, and others. Within the realm of EMS and other healthcare industries, some OSHA regulations take center stage. These include the use of personal protective equipment, OSHA's bloodborne pathogens standard, and OSHA's respiratory protection standard, which applies to wearing N95 particulate filtering respirators. Personal protective equipment is covered in greater depth in a subsequent module, so we will not discuss the topic in much detail right now. Needless to say, however, PPE is a critical component of OSHA's bloodborne pathogen standard, in which healthcare providers must follow universal or standard precautions and assume all bodily fluids are infectious. For the paramedic, this standard also requires a safe use and disposal of needles. These safety precautions also include an occupational health component, immunizations. Not only must the EMS provider protect him or herself against infection, but that same EMS provider also owes a duty to the public to not spread infection if it can be avoided. Being properly immunized is critical to avoid serious and sometimes deadly diseases, such as hepatitis B, measles, mumps, rubella, varicella, tetanus, diphtheria, pertussis, and influenza. While not all states require such immunizations by law, these vaccinations are strongly recommended for all healthcare workers by the CDC. Another interesting and important facet of OSHA regulations is something known as the General Duty Clause. By the language in the OSHA regulation, employers are required to furnish employees with a workplace that is free from recognized hazards that cause or are likely to cause death or serious physical harm. Even if there is no particular standard adopted within the OSHA regulations to cover a particular event, if there was a recognized hazard and the employer failed to take feasible and useful methods to correct the hazard, a subsequent employee injury or death could result in an OSHA General Duty Clause citation. Some additional safety, health, and wellness recommendations for EMS providers includes ensuring all EMS and patient care equipment are operated safely. A good example would be the use of the cot or stretcher. Lifting patients and loading patients into the ambulance should be done with adequate resources, enough personnel, to distribute the weight of the patient and avoid back injuries. There are also pinch points in expanding and retracting the legs on the cot. EMS providers should ensure their fingers are clear when the legs are being extended or retracted. This is just one simple example of ensuring EMS and patient care equipment is operated safely. Lastly, and often overlooked, is that of controlling the environment when possible. EMS functions in all sorts of environments, and temperature extremes can be problematic for not only patients, but EMS providers as well. Adequate scene lighting can also be a challenge for EMS providers. Whenever possible, controlling the environment can be critical for helping ensure safety and well-being. This could mean moving a patient from an unsafe or poor environment to one in which it is possible to control the lighting or temperature. Believe it or not, that brings us to the end of this brief module. Do not worry though, there are more presentations available that address paramedic safety, health, and wellness. For the time being, however, given your completion of this module, you should now be able to identify standard EMS safety precautions. This presentation was prepared by Waukesha County Technical College in Pewaukee, Wisconsin, and is distributed with an Attribution Non-Commercial Share-alike 4.0 International Creative Commons license. Copyright 2018 Waukesha County Technical College. For information on WCTC's numerous fire and EMS educational offerings, please visit us online at wctc.edu.